Hi, I'm Ketan from Brightside Dental. Welcome to episode 15 of BSTV. A few weeks ago, I spoke about the single most important thing at Brightside Dental is the safety of our patients and team members. Recently, we have taken on an NHS contract for oral surgery for complex extractions, and as part of that, we had to go through a rigorous screening process and application as well. And during the last few months, we've had 2 inspections carried out by the NHS. The most recent one was just in October, and that was specifically regarding infection control and contamination and what we do to prevent these things in the practice, and so that we're working to nationally recognised standards. So for that, what happened was we had an inspector come to the practice. She spent a morning with us and she carried out a very comprehensive 174-point assessment with a checklist of various things she needed to check and see what we're doing or not doing. And I'm really pleased to say that with the report we received, we scored a 98% pass rate, which is really, really high. It was really pleasing to hear, because on the day as well, the inspector, this is what she does day in, day out, visits practices to see how they're performing, and she was really, really impressed with what we're doing, our equipment and our protocols. From the report, there were some minor recommendations which we've already put in place, so in theory we're above the 98%, probably nearer 100%, which is great. So super proud of our team, who work really hard every day to make sure that we meet regulations and guidance, and where we can, we exceed that as well. This is something I don't think any of our patients have seen before. This is our dedicated decontamination room. So just a brief tour of it. So we have a dirty area on the side, you can see, where we have separate sinks for dirty instruments, and then as we're cleaning, a big grey box is an ultrasonic cleaner to help clean the instruments, and then we have autoclaves which sterilise the instruments. Where we can, we use disposable materials and instruments wherever possible, but some we do need to reuse. So this is where they're cleaned and that it goes through a strict, rigorous process. And every day we have a dedicated decontamination nurse to make sure all our equipment and instruments are clean and ready for our patients. We also have lots and lots of types of waste, and I think it's 8 different types of waste segregation in the practice as well. Thanks very much for listening, and join me next time for more practice news and tips on how to maintain and improve your oral health. Have a great week.